right now in your shoulder, what we're noticing is a few different things. Well, every almost like the rotator cuff exercises that I tested you on, you were actually pretty good.
And I do J bands also.
Okay.
Yeah.
So you were pretty good in this internal
Yeah.
external. It's when I started to abduct
Okay.
the shoulder, which is like real life. Like when you sit here, like do this, you're fine.
Yeah.
I think you have enough mechanics, enough health, all that other stuff to kind of get through 40, 50 inches or 40, 50 pitches, and then you can probably get through it. And
Yeah.
I just think you're causing yourself some breakdown.
Yeah.
I do think you need time to let the water settle,
Mhm.
which is the perfect time right now, by the way, because you're having, in the past, you had bicep. You said bicep tendonitis, right?
I think so. I mean, I didn't get it I didn't get it checked, but like.
Well, in baseball, bicep tendonitis is typically a faulty movement pattern of the shoulder and the rotator cuff, and then the bicep works a little harder. We also got to remember that when we are talking about the bicep tendonitis or bicep, we have to talk about the labrum.
Okay.
Here's the glenoid labrum, which is a ring of cartilage, right?
Mhm.
So this is just the ligaments here. So this is where the ball and socket attach into, right? Right into here. So imagine this is the ball.
Yeah.
That's where your humerus is. So this little labrum right there is part of the bicep tendon.
Yeah.
Let's show you here. So if we come here and we show you, now obviously we got rid of the bone, but let's put the bone back. We follow that biceps and it becomes part of the capsule. And then if we kind of see, like, get rid of the capsule, look at where it kind of attaches to. It actually becomes the top of the labrum. When I pull down onto that, they kind of like pulls on the labrum a little bit. When I do up on it, and I do this, like, we call it location relocation test. Like it's kind of like we're testing for the stability of the labrum.
Yeah.
You have stability, just so you know. Don't freak out. But like it's not torn or anything like that. I don't think it's torn.
If it was torn,
I think it's
then I don't
disrupted.
think I'd be able to throw.
I think it's disrupted.
Okay.
And so think about it like a rope. I give you a brand new rope, and you pass it back and forth to me, and eventually it starts to fray, and you're like, hey, let's just cut away the strands for a little bit, and like we'll, burn off the strands, and we'll be good to go, and then, or you can have the same people just keep playing with the rope, and it'll eventually fray more, right, and then it'll rip. So I think you're in that, like, we have a decision to make, and I think this is one of the reasons why almost you had a lot of tenderness, not only on the bicep tendon, but you also had a little bit of tenderness on the inside of the short head of the bicep. Why is this not popping up? Well, there's a short head and a long head.
Okay.
So you had the short head also that was pretty tender, like right through here.
Yeah.
So I think in your case, it's about like continuing on doing exercises without
Like rotator cuffs.
Yeah, you could still do that stuff, but I think you might need some more stuff later. I think maybe like right now your training program might be too progressive, like right now, because it depends on what you're doing. Again, I'm not there. This is where I may recommend a strength and conditioning coach that really knows their stuff in terms of shoulder and all this other stuff. I mean, I noticed just like in your shoulder, you're just losing some range, and usually with rotator cuff or I guess you could say glenoid labrum stuff, like if you have instability, doing this really sucks. It didn't hurt for you, and it wasn't bothersome for you, but it caused you a little pain, and I think that it's starting to get a little bit too frayed and loose in there, and I think everything else around it is starting to work too hard, too fast. Why did this happen? What is the movement dysfunction that started this? Pitching. Now, was it your mechanics? Was it the fact that you're just constantly working your butt off? Maybe it's just too much. But I don't think you need a huge rebuilding process.
Yeah.
I don't. I do think you need to get rid of some of the crappy exercises too. So would I go out there and long toss, if you ask me? So first of all, let me just say this. If you ask me one question about strength and conditioning, you might get a different answer than you ask 10 other people,
Yeah,
right? And
of
I just
course.
want you to know that.
Yeah.
I think it's very, very wise for you to seek somebody who is going to divert you through a full-blown strength and conditioning program at some point, especially if you're potentially getting recruited. That's just my opinion.
Yeah.
You know, it's something I wish I had that I didn't have, and I just didn't know any better.
Yeah.
And so I'm letting you know, as the outside professional who has been in collegiate sports and
Yeah.
and somebody who's recruited and somebody who treats pro athletes for a living.
Yeah.
It's definitely worth it.
Yeah.
Maybe not right now, but maybe in a couple weeks. And when do you plan on starting up pitching again?
I know my next camp, like that I'm signed up for or showcase, is at the end of July, but we'll see if I sign up for a different one or what.
So you have a good amount of time.
Yeah, I have time to rest.
Okay. And I don't think you have to do nothing. I just think you can probably gain some serious size and strength. Like you could probably gain a few pounds of muscle, even a couple pounds of muscle, by then, just by working some leg stuff. And I'm
Yeah.
not saying you shouldn't do upper body.
Like
Just so you know.
focus legs more.
And I'm not saying that you shouldn't do some tossing. I'm just saying that maybe for a week or so, or even 4 or 5 days, we shut down the arm
Okay.
to get it to, you know, again, we can also clone you, so to speak, and, you know, and then say, hey, you're going to get shut down, and then you're going to exercise, and what would be the end result? We can't do that,
Yeah.
obviously. But we can say, for you, like, I think that if we shut you down for a few days, just give you some rest for a few days,
Yeah.
let the inflammation or the water settle a little bit, I think you'll feel a lot better. I just don't know how often you're gonna pitch.
I don't pitch often, so what I do in like the training facility I go to is a lot of the stuff
Is
we
up in
do-
LA too, right?
Yeah.
Okay.
Is a lot of the stuff we do is like for specifically like velocity training is like medicine balls and like throwing medicine balls.
Against walls, yeah.
And like
I mean-
with the pitching motion probably and
Of
like
course.
rotational
Like
stuff.
this, yeah. I really think that if you stick to some of the basic stuff, the band work, stuff like that,
Yeah.
a lot of hinging stuff with your you know, a good amount of running and stuff like that, a good amount of leg based work, squats, deadlifts, hex squats, or hex bars.
Are cleans okay? For
I wouldn't do any overhead pressing right now.
no, like just like clean count. Or
I
like-
just think that's a little bit on
It's a
your
little
on your
bit,
shoulder right
yeah.
now. I think I would just take some time off. Like you
Okay.
have so much time to
Yeah.
live, and you're so young. Like, why? Like, if you delayed one showcase, for example,
Yeah. It's not that
not a
big
big deal.
Yeah.
Not a big deal. But if you hurt yourself
Then everything.
and now you have to rebuild for 3 months,
Mhm.
you've lost many showcases.
Yeah.
You could, especially in the height of summer, you could probably pick a showcase any weekend.
Yeah.
You know?
You can pick one every day.
Yeah, you can probably go any day. I mean, yes, granted, you got to pay for some of them.